Action.
Hey everybody! This is a presentation by Renee, Rosalind, Jana, and Veronica. Today we're going to be talking about new parents with infants and their oral care. So we're going to be talking about basics, home care, thumb sucking, pacifiers, teething, lifting the lip, baby bottle tooth decay, as well as passing bacteria onto your baby. So I'm starting off with the basics. So primary teeth of the baby start to form in the first trimester of pregnancy, and the permanent teeth form in the second. You have to be really careful of the medications you take while pregnant because not only does it affect the primary teeth, but it can also affect the permanent. The first tooth appears after birth, 6 to 8 months, and by age 3, 20 little teeth should be present. If your baby doesn't have teeth by 12 months of age, you should consult a pediatric dentist. Delayed teeth is usually hereditary and does not necessarily indicate any problems. The first visit to the dentist should take place as soon as the child's first tooth erupts. This will get your child used to visiting the dentist as well as creating a preventative dental care for your child with the dentist. Second visit occurs 2 to 5 years of age or when all the primary teeth have erupted. This is to check the development of the teeth and to see that the preventative care plan has been followed. 3 to 5 years of age, the doctor will check teeth and jaws and to see if any decay has occurred. This is also the time of their life when fluoride would be introduced. After this, the dentist should see your child about 1 to 2 times a year. As an infant, you want to clean their gums by putting a gauze pad or soft cloth over your finger. You want to dip this in water so it's moist but not too wet. Then wipe your child's teeth and gums gently. When the teeth come in, begin to use small soft brushes. So when you're using a soft brush on a child with erupted teeth, you want to do it for them and be sure to use non-fluoridated toothpaste. You don't want to use fluoridated toothpaste until the child is capable of spitting on their own. When you're cleaning the infant's gums, be sure to do it at least 2 times daily, especially after feedings and before bedtime. Flossing of your child's teeth should be done once the teeth start coming closer together. When you're looking for a brush to use on your child, you want to look for soft brush, small head, and a large handle. The dentist visits will give you advice about tooth care, teething, fluoride, and thumb sucking.
Hi, I'll be talking to you today about infant teething, thumb sucking, and pacifiers. Teething generally starts between the ages of 4 to 7 months, and it starts with the front teeth first, then the opposite fronts, the molars, and then the canines. Teething can usually be pretty painful for infants, so it's helpful to give them toys or frozen things to suck on or chew on. Also, if you get a little rubber toothbrush to put on your finger and rub their gums with it, that can help make them feel a little bit better as well. You want to make sure when you're using these things to keep them very clean. Also, using medicines such as Tylenol is helpful for your infant. You want to make sure to ask your pediatrician before you use Tylenol. Some parents are interested in using amber necklaces. This is important to make sure that you put this around their feet because it can be a choking hazard around their neck. You always want to watch them while they're wearing it to make sure that they aren't choking, and you don't want to let them wear it to bed. Some signs and symptoms of teething are red, swollen gums, increase in saliva because of drooling, and some anxiety, lack in appetite, change in nutrition, or difficulty sleeping. So thumb sucking is also a very natural and normal thing that infants do. Sometimes they can even do it before they're born. But one thing about thumb sucking is that it can transfer a lot of bacteria. Also, it can cause teeth to become malpositioned. It's better to use a pacifier than to have your child suck their thumb for many reasons. Once teeth begin to erupt, infants can begin to bite their hands as well, and that isn't good when they're sucking their thumb. But infants should not be discouraged during the first year of their life to sucking their thumb because it can be very comforting for babies, but it should not be continued over the age of 4. To stop the thumb sucking, you should put a Band-Aid or a sock on their hand while they sleep, and that usually will stop the thumb sucking. So pacifiers are a great alternative to thumb sucking. They can also be very comforting to infants. If you drop a pacifier on the floor, you should never lick it and give it back to your child because it can have a lot of bacteria on it. Also, don't give them a pacifier if it's punctured or broken, and don't ever let them wear it as a necklace because that can be a choking hazard. You also never want to put sugar on the pacifier because that can cause a lot of decay. You don't want any prolonged use of a pacifier because that can cause misaligned teeth, and you don't want a child to be too dependent on a pacifier, but it can be a good distraction or help them fall asleep. You want to make sure to clean your pacifier regularly, and pacifiers can also help with the development of cheeks because of the sucking motion that infants make. You want to make sure that your child is completely done sucking their thumb and using a pacifier by the age of 4 because their teeth and jaw can become malpositioned if they continue. Pacifiers also, they cause a lot less damage than thumb sucking.
Baby bottle tooth decay happens when things like milk, formula, and fruit juice are left for a prolonged time in the baby's mouth and they cling to the teeth or gums. Baby bottle tooth decay most often happens in the upper front teeth, but all teeth may be affected. Children that are most at risk are children who are given pacifiers dipped in sugar or syrup or given a bottle at night or at nap time. Giving a child a sugary drink at night or before bed is more harmful because the flow of saliva decreases at night and lets the sugar stay on the teeth for a prolonged amount of time. If left alone, baby bottle tooth decay will cause pain and infection and severely decayed teeth that will eventually need to be removed. Ways to combat baby bottle tooth decay is to never let them fall asleep with a bottle that has milk, formula, or other sweetened liquids. You should clean and massage the gums and gingival tissues. If a child loses a tooth due to decay, they may develop bad eating habits, speech problems, crooked teeth, and damaged adult teeth. Changing the child's diet can help prevent this from happening. Baby teeth generally fall out in a specific order, and the baby tooth is usually replaced by an adult tooth within 3 months. Baby teeth help save space for adult teeth until they come in. If the baby tooth falls out early, the space may be lost and it can cause crowding with the unerupted adult teeth. When they do become crowded, the adult teeth may not be able to push through and it can become crooked. You will not be able to fix this by removing the baby teeth. The child will need to have orthodontic treatment later in life. If your child does happen to lose a tooth, then a good option is to get a spacer to help maintain the space. Children should be weaned from the bottle as soon as they can drink from a cup, which is around their first birthday, but not too soon because the sucking motion helps them develop strong tongue and facial muscles. When checking a child's mouth, you should use the lick the lip method. If you are by yourself, lay the child on the floor, or if you have somebody with you, you should lay them on your lap. Gently move the baby's lip up and look at the teeth, tongue, and feel the soft tissues. If you see a white or brown spots in their teeth, you should make an appointment with a dentist.
Thank you for that.
Okay, so my topic was passing bacteria to babies. So babies aren't born with plaque-causing bacteria. It's transferred to them from saliva. The only way you can get it is parents or caregivers with active tooth decay can spread Streptococcus mutans, or MS. It is bacteria through the transfer of saliva. In a 2010 study in the Journal of Dental Research, they found that the children of moms who chewed xylitol gum starting at 6 months pregnancy were significantly less likely to show MS colonization. Also, xylitol gum has been tested as an alternative approach to reduce maternal MS infection and transmission of bacterial to baby. Xylitol inhibits the growth of MS and decreases their ability to stick to the teeth. There was 3 studies that they found when moms chewed the xylitol gum 2 to 3 times per day, beginning before the baby's teeth erupt or even during the pregnancy. The MS colonization of the baby's mouth was delayed and reduced. Most of the caries were reduced by age 5. This approach is low cost and easy addition to good dental hygiene care. Other identified risk factors for early childhood MS infection included nighttime nursing or early introduction of solid foods and exposure to food. There are saliva transfer methods include mom kissing baby on the mouth, biting food off and feeding it to the baby, sharing utensils, blowing on food, pre-chewing baby's food, their oral hygiene, and feeding practice, so like sucking on a sippy cupful of juice, soda, anything with sugar, and cleaning off the pacifier with your own mouth and giving it to the baby. Way to prevent MS is by wiping the baby's mouth with a wet cloth after everything, mainly the exposure of your own saliva, and then you can wipe their tongue, teeth, and cheeks from infancy and on. That's it.
I'm going to demonstrate how to take care of your child's teeth. First, I'm going to show you how to rub off all of the plaque.
Rub the gums.
To rub their gums after you feed them. You want to go in with a little piece of cotton and rub off the tops of the teeth, the sides, and the insides. Make sure to remember to do the tongue and the sides of the cheek. When you're brushing your child's teeth, you want to make sure to have a toothbrush like this, with a big handle, a small head, and soft bristles. When you're brushing, we want to use the modified Bass technique, which is used at a 45-degree angle positioned up towards the gums, and you're going to be using a back and forth motion. This will remove all of the plaque and make sure that it does not turn into tartar and cause decay. You also want to make sure to brush the tongue and the cheeks. As soon as your child's teeth start to touch each other, you want to make sure to floss them. Here's an example of how to floss. You go in between and you go up and down, and you want to make sure to wrap around the whole tooth. You want to do this between every contact of the teeth. Thank you.
And that concludes our presentation behind the scenes.
Can we watch it now?